Hello, I'm Dr. Dennis McKenna, and I'm so happy today to be joined by Dr. Ashley Telisky. Ashley, great to have you here.
Always a pleasure.
Today is Monday, July 7th, giving you the update from Albany Med. Now, Dr. Telisky, you've been here 3-4 times in the past. I know we've done this a few times. You hold several titles here in the health system. Let's just clarify those. You are the vice chair in the Department of Emergency Medicine for System Integration, helping us with the emergency medicine operations not only on the Albany campus, but Columbia Memorial and Glens Falls Hospital. And of course, you work closely with our colleagues at Saratoga Hospital as well. And you're Chief Logistics Officer. So we're going to talk about all of those roles today. Before we begin, I have a trivia question for you. Do you like sports trivia?
No.
Okay. What team won the Section 2 championship in soccer, in girls soccer in 2001?
Too funny.
Who won it?
Was it the Whitehall Railroaders?
The Whitehall Railroaders. And how many goals did you score in that game?
Unbelievable. I know.
Two. Read the article. Point being, local girl, and rose up through the ranks here at Albany Med. So it's part of our story, right? People from the area who go to school locally stay here. You're one of those people, so I thought we'd have a little fun and mention that for everybody. All right, let's jump into something that you know a lot about, which is urgent care and pediatric urgent care. We have a campaign out there right now reminding people in the community that in the Albany Med Health System we have multiple different urgent care locations. And there's a particular reason why if people need to access one for a child, why they should come to the ones in the Albany Med Health System. And that's because obviously the linkage to the Bernard and Millie Duker Children's Hospital and the Masry Family Emergency Care Center. Talk a little bit about that.
So it's wonderful. You don't have to come through our pediatric emergency room door. You can go to any one of our urgent cares and they easily can access our pediatric emergency medicine trained physicians to help them navigate the care of a child. So it's wonderful treating you right where you show up.
Right. I mean, so summertime, we know, right? Scrapes and fall down, injuries, soft tissue injuries, a lot of those end up in urgent cares. Sometimes there's a broken bone. Sometimes there's a need for more advanced specialty services. So the physician assistants and the physicians who work in those urgent cares, if they need to access either immediately or for follow-up, the pediatric specialists at Albany Med, they can make that call immediately.
And we've also provided some enhanced training for them and education so they can help identify when a child does need to go, in fact, to an emergency department or they need some additional help.
So it's a great reminder. Again, we say in our family that a scrape on the knee is a sign of a good summer. It means you're outside, you're active, you're busy. But things happen, right? People get stung by insects or they have some sort of injury from sports. Just a great reminder that if you have to, consider the emergent care and urgent cares of the Albany Med Health System. Some exciting news recently in the area of cardiovascular care. On the Albany campus, there's been 2 recent individuals who joined the team here, joining already what is a remarkable team of cardiologists and cardiac surgeons and nurses and cardiovascular techs and perfusionists and everybody else. But we welcome into the Albany Med family Dr. Soon Park, who will be our surgical director for cardiovascular surgery at Albany Med, and Dr. Mushabar Syed, who is going to be the chief of cardiology here at Albany Med. 2 wonderful additions.
Wonderful.
Yeah,
welcome.
They're going to help chart our course for cardiac excellence, and they join an amazing team already. And I know both of them have already hit the ground running, and we welcome them here and look forward to all the great things that they can do. Now, Ashley, you have also been involved in some of the early kickoff on what we're calling for the Albany Med Health System, our enterprise transformation. And this is what will be a 12 to 18-month initiative with really all campuses involved, focusing on 3 particular areas. 1, writing the strategic plan for the Albany Med Health System for the next 10 years. 2, focusing on those corporate services that currently are fully integrated in the system and those that are not, and what we can do to do more together as a health system. And the 3rd, the provider enterprise. By that I mean employed physicians, physicians in the community, their role in the college, their role on the other campuses. So it's going to be a lot of work. We did a town hall kickoff. You were there. What's the general reaction? Are people excited about this work? Do they want to get involved in this work?
Ton of excitement. I know personally we love system work.
Right.
It's elevating care everywhere in our region. So this is a great time for us as a system to get even stronger and provide such excellent services across our region and beyond. So many people look to us beyond our region for this care. So it's tremendous that we'll be even stronger together going forward. So ton of excitement.
Absolutely. And ECG is the group that we're working with. They work in this space. They work with all the best known healthcare organizations really throughout the country. They only focus on healthcare transformation work. And we already have an outstanding product here in the system, but this is really about taking us to the next level. We're going to need your help. Survey tools, letting people shadow you, providing data, giving your feedback, joining groups. Thank you in advance for the work you'll do, and we'll update you on that frequently. All right, let's transition over to the work that I know you're very passionate about, the work that you love doing, logistics. Let's start first of all with the fact that we've been focusing over the last year or so really on what I call the experience, right? The experience of the patient, the experience of the visitor, the experience of our learners, and the experience of our staff. So there's a lot around that, making sure that we provide an experience that matches the world-class care, which really gets us to these pins. I'm wearing one, you're wearing one. I'm going to show you a picture. I was walking down the hall today. I saw two of our fabulous nurse leaders, Johanna and Annalyn, people we both know. There's a lot of people walking around with these Ask Me pins. What are they?
So it's so exciting. Efficient, high-quality care is what we strive for.
Right.
One of the metrics we watch is length of stay. That can tell us how efficiently we're providing care. There's an ideal part or ideal timeline for a patient who stays here with certain disease processes. Once you go beyond that, there's risk of complications. Being in a hospital for too long out of your normal environment is not good for anybody. It's better to get back to your normal daily living. And so we've recognized, though, that requires really strong communication between patients, caregivers, and our care team on the front line. Sometimes it's a scary moment for patients and family, and they forget to ask questions or feel like some of their questions might be too simple to even ask. We now have these buttons in a campaign that really encourages patients and caregivers, their family and friends, to ask us. Some of the questions, too, that we've highlighted on various advertisements across the campus is really ask us these 4 questions. And the questions include, why am I here in the hospital? So what's the diagnosis? What are the milestones for today and for each day that I'm here in the hospital? When do I get to go home? When will I be discharged? And what can I do as a patient or caregiver to help in my recovery? All of those things are so crucial to keep us focused, to provide high quality, efficient care. And really, it's powerful to think that eating and moving can really move the needle on somebody's health and wellness. And so nothing is too simple to ask, and we really want to encourage strong communication with patients, caregivers, and our care teams.
No, I love it. What I love about the PIN is it essentially takes down that barrier, right? It empowers the patient to feel comfortable saying to the physician, I have a question, and I feel comfortable doing it because your button says, ask me. And the individuals who are wearing these, I think, have recognized the importance of permissioning the patient, encouraging them to be part of their own care, and asking questions, and not just the patient, but their visitors who are in the hospital as well. So the more that can wear these, the better. It sets, I think, the right tone. And thank you for launching the campaign. Thank you to nurses like Annalyn and Johanna and others that I see, and physicians that are wearing these, and really everybody. So it's a wonderful thing. And thank you for those 4 questions. Another thing which will also help with the movement of patients and information is technology, right? My Epic, first of all, and then in Epic, something called My Chart, and then there's something called My Chart Bedside. What is this?
So within the Epic platform, in the My Chart portal, a wonderful feature that we have is called My Chart Bedside. And so as soon as a patient is admitted into the hospital, it automatically converts their portal into Bedside. It's an application on your phone. The patient and their caregivers, family, who are even at a distance, can keep up to date on everything that's happening instantaneously in the hospital. it aligns with some of those 4 questions, so you can
Right.
stay up to speed without even having to ask questions. Why am I in the hospital? What are my milestones? When will I be discharged? And what can I do in helping my own recovery? Things like mobility, etc. So we will have more information coming. It is already functional
Right.
and on. We have some tweaks upcoming,
Right.
but in the next month you'll see a big push, and we ask that everybody please embrace the technology, lean in with your patients
Yep.
and their caregivers, encourage them to get on the portal, get on MyChart Bedside, and stay up to date on what is happening with their care. It's very powerful, and it'll drive great care here.
It will, and you gave a couple perfect examples. So there are adults who have parents who may be in the hospital, they may be working during the day. This is a great way for them to kind of keep track of what's happening so that when they come in the evening, they've already looked up the results, they've already seen some of the results. I think the message you're sending to our workforce who's watching this is please encourage your patients to download this. This will make for better communication. And if you happen to be someone who is a patient here or will be a patient, download it, use it. It's great.
Yes.
It's one. It really is one of dozens of examples of why we made the investment in Epic and leveraging that and all the great advantages we're really just beginning to take advantage of now. Last topic, you touched on it briefly, but just spend another maybe minute on it, mobility, the importance of being mobile. We know that people come in the hospital, they may have had a traumatic event, maybe a stroke, maybe something that knocked them out physically. And only a couple days in the bed, and you're already deconditioning. Talk about the importance of getting up and moving and why that helps with discharging patients to the next appropriate level of care.
Even small movements
Right.
impact so much of your entire body.
Right.
And so really it is just as important as taking your medicine while you're here and eating food.
Right.
Movement is critical. Movement is medicine.
Movement is medicine.
Many of us will say. And so we really are going to also have an effort upcoming to
Right.
ensure that staff feel comfortable and trained to help
Right.
those who really need some additional support and movement, but also encouraging patients to move whenever they can, whenever possible for them. It's like exercising
Right.
every day, and that may mean even just walking.
Right.
So really encouraging that piece of medicine. Encouraging mobility will also encourage and ensure high quality care that is efficient in the hospital. Unfortunately, as people feel like maybe I should not move and I'll get well, in fact, it's just the opposite. And so want to encourage that as well for our workforce to embrace it, but also patients and caregivers to learn how to move and move often.
I know all of our therapists, physical therapy, occupational
Incredible.
therapy, they would all welcome this conversation from
Oh,
them
yes.
as well.
And you
Yes.
have a button,
Tell
an
me about
additional button.
Tell me what that button
Be
is.
wise and mobilize.
Be wise
this
and
is from our
mobilize.
friends in PTOT.
Very-
Yes.
Excellent. All right, very good. So some important updates really on the things that our workforce can do to encourage patients, to encourage family members to be part of that care delivery. Asking questions, checking your MyChart Bedside, getting up and moving. These are all really important initiatives. So thank you for leading them. And it just goes to show the logistics center and the work that you're doing there is not just about bringing patients into the hospital, which of course is fabulous, right? Because 17,000 times a year they need us. We get them in. But it's really about making sure that we are as efficient as we can with care delivery once they're here. So thank you to you and your team.
Thank you.
All right. We've done this 3 times. 3rd time's the charm. This was the best. Thank you. All right. For all of you who are working over this last 4th of July weekend, we really appreciate you coming in. And I had the opportunity to see some of you, and thank you for your working here over the holiday weekend. So thank you for that as well. And we'll be back again in a few weeks, give you a couple updates on what's happening with all of these important projects. Ashley, thank you for being here. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 weeks.